Why don't doctors do a full body scan to see if someone has tumors cancer as part of preventative care? Because MRIs and CT scans cost a fortune to perform and analyze 6-10K per. They are very expensive equipment to purchase, set up, and operate, so it's not like every doctor's office can have one, so there's a limited number of available times to have one performed. Moreover, most people don't have cancer, so most of those scans are going to be needless. In addition to the cost and the radiation exposure from a CAT scan, MRIs use magnets. False positives are a thing. Similarly, medicalizing oddities or slight abnormalities can cause more trouble than benefit. These leads to treatment of conditions that may not have caused issues if left alone. One example is that 15 years ago, abnormal pap smears in younger women led to treatment that sometimes caused more harm than good. The vast majority of these certain type of abnormalities heal on their own. This lead to changes in medical screening recommendations and treatment. Mostly cost and waiting times for the appointment. I need to wait at least 4 months to even consult a specialist where I live. Due to the long waiting times, here too people often get to hear that their tumor has grown large and more could have been done if it were only discovered sooner. And some scans, in order to be effective, require infusions of a contrast medium. Not everyone can read scans, only a narrow band of specialists. Some are allergic to the contrast. Whole body MRIs are poor. The bigger the area, the worse the quality. For a high-quality whole body you need a ton of small scans, and that would end up having tons of artifacts and taking forever. Cancers that don't have symptoms are typically not obvious on routine CT. If you scrutinize the CT scans to the level necessary to find subtle signs of cancer, you'd call more fake-outs than actual cancer. Those patients will get all kind of extra tests, biopsies, and surgery that will hurt them thinking they are fighting cancer, but were just false positives from the CT scan. Most of the time with stuff like this, it's in part due to the false positive rate. No test is perfect, and so you have to weigh the amount of people that this would help versus the amount of people that would have some sort of anomaly and would need to go for further testing when their condition is actually benign. People are full of random polyps, cysts, nodules, and scar tissue that we can live with perfectly fine, but may look spooky on a scan. False positives are not just bad because you give people the fright of their lives, but ruling out cancer may require invasive or expensive follow-up procedures and take the time of scarce resources like cancer specialists. False positives are one of the reasons cancer screening for various cancers doesn't start until people reach a certain age, and why different countries or different methods have different guidelines. The airport scanner knows if I have a hair tie in my jeans pocket, for fuck's sake, I guess. But sort of true. You have no idea how often I thought of this in nursing school. If we have the technology to help people, why don't we utilize it? I had cancer with no symptoms, caught by pure luck. I managed to haggle my doctor into CT scans every year for the first few years of remission. While I'm gonna keep pushing to extend that, it's a lot more time consuming than your average doctor's visit. I'm there for like 3 hours plus you have to fast. Also luckily, I have a few expensive medical things, so I'm gonna hit my OOP max regardless cause it's not cheap. My understanding is that PET scans are the gold standard for detecting cancer of all types, but are even more expensive than MRI or CT scans. It comes down to cost above all else. Because the radiation from yearly full body scans can cause tumors, high incidence cancers are also screened in other ways such as mammograms, breast exams monthly, colonoscopy, testicular exams, digital rectal exams. Even my dentist checks for jaw cancer. I assume she does palpation for tumors, because insurance ain't paying for that shit. CT scans dose with radiation. MRIs require the patient not have metal in them. Expense, low yield, risk of false positive findings. Some scans use radiation. The odds are that they will find something. However, the reality is that for many people the risk of surgery or the stress and anxiety associated with finding something off in the body would cause more harm than good. A lot of healthcare is also about identifying immediate risks to the body. This is a very simple ELI5 scenario. Not everything needs an immediate action or should have immediate action. Watch and wait is a valid approach to care until something starts to cause issues, as the treatments can also have major complications. For example, a very slow-growing benign tumor may have a high risk associated with the surgery, but for many people the moment they hear tumor they want it out of them. Does it make sense to undergo a risky operation for something that could actually have a higher risk of killing compared to just watching to see if the tumor changes? Similarly, this would likely lead to a massive influx of expensive care treatments for no real discernible benefit to individuals or society as a whole, and may lead to more chronic health conditions due to surgery complications, quality of life impacts, or associated medications. Source: I have PhD in health systems and services. Equipment time is expensive. You need skilled persons to operate these machines safely. Doctors have to be paid when they look at results to make sure they don't suffer lawsuits with misdiagnosis. Everything is money. Costly. There isn't some magic scanner like Star Trek. Full body scans take a long time to perform. Then the real cost kicks in. You need to have a radiologist examine the images. For a whole body, that's a lot of images to go through. What are you scanning for? Radiologists have specializations for different ailments. The 500 full body scan they try to sell you on the internet is like a blurry snapshot. It does not show the sort of detail that doctors find useful. They have those kinds of scans. Not everyone can afford it, and if there are sons like my mom who don't want to know,